Good afternoon, class. My name is Claudia Haley, and today I will be your CPR instructor. So, a couple of things that I need to make you aware of before we get started is that I have included a student packet, and in this student packet, we have a sheet, so you look at your packet, that has a learning activity, okay? The learning activity has a diagram for how to properly open up an airway, and the second diagram is how to properly do chest compressions, okay? So that's one, and then the second one will be your skill sheet. In order to pass this course, or to get credit for this course, is that you need a proper skill sheet, okay? So we will go over these. Your skills instructor will go over this, and then of course you got to attempt to pass the CPR course so that you can get full credit. Then afterwards, we're gonna have an exam and an evaluation sheet. So I would greatly appreciate if you fill out this evaluation sheet at the end of class. Okay, so let's get started. So today we're going to go over CPR. Okay, reminder, the CPR, what it is basically we are doing the manual job of the heart. We're trying to get that blood flow to the rest of the body, especially the vital organs. So we're gonna do this manually. So we're gonna do compressions and we're going to do rescue breaths. So before any call, this goes for any call, the number one priority is scene safety, okay? Is our environment safe to enter? If it is, part of our scene safety is our PPE, okay? Depending on the SOPs of your station, make sure you follow them. Most of them will require gloves, goggles, and some type of mask. There are some stations or there's some companies, fire departments that will require gowns. So just make sure that you follow your SOPs. Of course, this is to keep ourselves safe. We don't want to be we don't want to become a patient in one of these calls. So what are our priorities? We're gonna work with the airway, breathing, and chest compressions, okay? So there's a couple of things that we have to notice when we are ready for these CPR calls, okay? For most part, I mean, when the call comes in with somebody complaining of chest pain, we normally think, once again, it's going to be a cardiac issue. There's been cases where, of course, we show up to scene, and then there's already people on the floor. There's a person on the floor. So I tend to go through this checklist in my head. So how to recognize it is a cardiac emergency. First of all, if the patient is unconscious, I tap on the shoulder, I yell and tap at their shoulder, sir, or ma'am, are you okay? Okay. If there's no response, I do a chest rub, okay, to see if that wake up, or I also do the cardiac pulse. I tend to check to my left, everything to my left, blood pressure to my left, everything to my left. Even when I auscultate, I start to my left. Okay, so I will check the pulse. If I don't see anything, and meanwhile I'm checking their pulse, I'm trying to see if their chest is rising or not. Okay, I also check if they have any bodily fluids in their mouth. Sometimes there's vomit, sometimes there's some type of sputum, blood. So I check for all these things because, of course, that is important so that the patient doesn't aspirate. Okay. Along with that, sometimes there's been cases where the patient is laying down. So normally it is recommended that we carefully turn that patient, trying to hold that C-spine. Okay. After that, I start my compressions. Okay. So proper compressions. We're going to locate the center of the chest. Okay. And then we're going to interlock our fingers. Now, palm means to make connection to the patient's chest. Normally what I do is lay my left down. It's a good rule of thumb for me. Left, everything's left, okay? I lift my palm down, okay? And then I curl my fingers up, of course the bottom one, curl my fingers up, and then I start the compressions. Make sure that my elbows are straight, okay? I will do 30 compressions. The cycle is 5 cycles of 30 compressions and then 2 rescue breaths. And normally my count is in 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 until I get to 30. And then I will do 2 rescue breaths. 2 inches deep. If it's the first time, you will know it's the first time the patient is receiving chest compressions. We know that because we're gonna hear some cracking, okay? So 2 inches deep. Make sure that you are going deep in there. Sometimes there's patients that are heavier than others. Of course, it's gonna take more of your strength to get down there. Okay, 30 chest compressions, 2 rescue breaths. So, 5 cycles. Heart Association did establish that they rather for us do chest compressions over rescue breaths because once again, we're doing that manual job of the heart. If you're working with somebody else, or if you can quickly, if you want to, I think it's up to the first responder. Okay, then we're going to do the rescue breaths. There's 2 techniques to open the jaw. Now, first, look if there's any malformation in their jaw or their face. Sometimes they've been through an accident that, of course, leads to injuries to the face and the jaw. In case the patient hasn't been through any of these type of injuries, what we're gonna do, we have 2 options. We do the jaw thrust, okay? So this is where we lift right here from the jaw, or there's a head tilt chin lift, okay? So these are the 2 to go when it comes to open up a proper airway. And then we're gonna do the rescue breaths. It is recommended, of course, that we use the BVM. Make sure that you cover with the mask, that fully cover the nose and the mouth. In order to hold those down properly, you can either use the C or the E, okay? I tend to prefer the E, depending on also the length of the first responder's fingers, okay? Just make sure that you have a proper seal, okay? I've also seen when there's not a proper seal, so you don't see that chest rise. And 2, you can hear every so often when the pumps of air go in and they actually goes through the sides of their face. 2 rescue breaths, 1 second each. Okay, 1, 2. And then you start the compressions again. So what are we going to look at when it comes to the rescue breaths? Well, we're gonna see a proper chest raise, okay? What would be an improper rescue breath? Stomach rises. That means that we're getting too much air into the stomach and it's not going to the proper paths, right, which is the lung. So we have to make sure that we notice that when we do the chest, when we do the rescue breaths, okay? And that's, if it's 2 of you working, you notice that, and if you notice that the chest is not rising, what do? We modify very quickly. Once again, 30 chest compressions, 2 breaths, 5 cycles. Meanwhile, hopefully by this time, your partner, if it's a partner, if it's 2 people, if you have more than 2 people, then you're lucky, okay? So by this time, your partner should be back with the AED. The AED is something that, of course, will help the patient out. So there's a couple of things that we need to follow the AED. Most of them, they're self-explanatory, okay? I remember my EMT professor said it's firefighter proof. There's no way that you can mess this up, okay? So this one has a diagram. So in this case, it normally tells you where to put it, and if you notice, it's crossing the chest where the heart is at, okay? That's where it's going to chop the heart. So what are the couple of things that we need to look at? Well, first of all, make sure that this person doesn't have a pacemaker. Make sure that they don't have any jewelry anywhere, okay? Make sure that their chest is clean. Of course, if it's a male and if there is a hairy chest, most of these AED packages will include a razor to remove as much hair as possible. There's some, I've seen some paramedics that what they do is that they grab the pad and then they rip the hair off and then they place it back again. Anything that you think is quicker or anything that's best for you, you modify and you do it to the best of your abilities, okay? Then we place them. Okay, most of them tend to be voice activated, and they will tell you to stand clear. Normally, I raise my hands, make sure that nothing is touching on the patient because any type of movement, the AED will pick up. Okay, it will let you know shock advisory, we'll stop, stand clear, and then it will let you know if the patient's going to get shocked. Now, in the case of that, there's some AEDs where you need to press the button. There's other AEDs where they're able to do it automatically. If that's the case, please make sure that you stand clear, okay? Even make sure, because we're on the ground for most of these procedures, okay? And make sure that none of your body parts are touching the patient, okay? And then either you deliver it manually or it will do it on its own, okay? So if it does it on its own, it will do it, and then what happens right after that? We go back to our chest compressions, okay? So don't forget, we're doing the manual labor of the heart. We're trying to provide blood flow to the vital organs in their body, of course, because time is of an essence when it comes to these calls. So I've been asking for, just by regular people, so when do I stop? When do I stop these compressions? Well, hopefully, fingers crossed, and the big man is looking upstairs, looking after this patient. Hopefully the patient will respond. There's been cases where I've seen patients who will respond, and they will respond in the middle of a thought, or sometimes in the middle of an act or a party, and they wonder where they're at, okay? And then we have to explain that they just had a heart attack. So until the patient responds, of course that's ideal, right? We like to bring our patients back. Or two, when you're being replaced, okay? In this case, don't forget that compressions are very demanding, physically demanding. So if you need a replacement, go ahead and ask for it, okay? Replacement or switch or change. I've heard a variety of things. Just make sure that you do it loud and clear so that they can hear you, so that next person jumps right into the cycle. Normally they tell you if you can get 2 cycles out, and then you have a change of person, okay? Or 3 until you're tired and you just can't proceed, okay? Of course, this depends on the areas that you're at. There's sometimes that they're very rural areas by the time people arrive, so it's until you get tired. Or there's also been cases where I've shown up to the ER and doctors and nurses like us to proceed with the compressions so that they can get everything set up. So normally it's until you're tired, okay? Hopefully by that time this patient is already being transferred to the hospital, and she are getting help, okay? So, but hopefully, like I said, our ideal scenario is that the patient comes back and responds. So this marks the end of the class. So don't forget, scene safety, number 1, of course. Scene safety when it comes to the scene, to the area. 2, make sure that you're wearing your proper PPE. When you get to the patient, look at the environment, what this person, it depends on why the call came in, correct? Look at the patient, make sure that you go through the checklist that I provided for you during the instruction, and then you start your compressions. Your compressions, don't forget, 2 inches deep, 30 compressions, 2 rescue breaths, and 5 cycles, okay? Make sure that the palm is making connections to the chest. Make sure that your elbows are straight, and 1 and 2 and 3 and 4 and 5, and do that until basically either the AED gets there, or where I said those 3 things happen, right? Either you bring the patient back, you get a replacement, or until you get tired. But those are normally the key things when it comes to CPR. We're gonna work with airway, breathing, and compressions. So thank you so much for your time. So the next phase of this is to do your skill sheet, okay? So you have 2 attempts. It's pretty easy, okay? It's basically what we discussed. Make sure that you know how to do the proper chest compressions, because of course we want to get help to these people, okay? You have 2 attempts to pass this test, and then of course there's the written part. We have to take a written exam. So there's a written portion up to this exam, and after you're done, we would really appreciate it if you fill out the evaluation, which is something that we need for this course so that we can improve, if anything. Do you have any advice to better our course for our for our training purposes. So if you have any questions, feel free to ask me. If there's nothing else, thank you so much for your time. Thank you for everything. Hopefully you learned something. Most of you are going to get certified, so this is a good refresher course. Thank you so much. Have a good day.